One issue I'd like to address with you is trigeminal neuralgia, which people often know as one-sided facial pain. The trigeminal nerve is one of your cranial nerves, one of the 12 nerves that basically come off of the back of your brain and your skull. And the trigeminal nerve provides sensation to your face. And there's 3 divisions. Division 1 is over the top of your face, about your eyebrow. Division 2 is kind of over your cheekbone. And Division 3 is along the bone here. It can come on as a result of something like shingles. It can come on from trauma or head injury. It can even come on after something like a botched dental procedure or an abscessed tooth. It's very painful at times. It can be extremely uncomfortable, and people who deal with this are often pretty miserable. So one thing we try to do is talk about some non-invasive ways to treat it. Medications can help, certainly, but we'll try a technique often called neurofascial prolotherapy. And NPT is a series of small injections, cutaneous injections under the skin with a very safe substance, either known as 5% dextrose or 5% mannitol. Dextrose and mannitol are natural sugars, very diluted down, that seem to have a calming or healing effect on the nerves. And what you're basically doing is finding the root of the nerve and the origins of the nerves, where you're basically finding the branches, and you're basically putting a small bleb of material underneath there. When the nerves are constricted and angry, they cause pain. If you can free them up, and if you can downregulate or decrease the inflammatory markers, there's a substance your body makes, for example, called calcitonin gene-related protein. There's one called substance P. Like if you've been bitten by a snake, your substance P goes way up because your pain receptors notch it up by a factor of 10. If you can quiet those down and make your body make things like somatostatin, which is something that basically it's a calming effect on your body, it settles the nerves down, people often notice very quick, immediate relief. It's very safe and easy to do. You use a very small 30-gauge needle, which is like a fiber optic cable. It's about that long, and you basically do a couple little pokes along the area that hurt. It's a little discomforting when you do it, but it's not very deep. It looks like a couple mosquito bites that goes down. And what you'll find if this works is that people will notice the effect tends to be cumulative. So for example, you'll do it one day and they'll say, I felt really good for about 2 days. Yes, it came back, so I don't think it worked. And tell them, well, all I'm injecting is sugar solution in you. You know, that shouldn't work at all, technically, but yes, if you talk to most of science, but people who do this understand that that's 2 days longer than it probably should have worked. And you'll do it again, and people will find that they'll come back and say, oh, now that worked for 10 days. And so you find after a couple of successive treatments often that the pain gets very diminished or goes away. Does it always work? No. But I know this, I haven't hurt somebody by doing it. This is a very safe substance, so it's low risk, high reward, which is something every doctor likes to do. So if you have a question about your facial pain, something you'd like to consider, please let us know and we'll be happy to work with you.